Hello, my name is Paul Studley. I coordinate the Cardiac Sonography program at Western Sydney University. In this short video, I'll give some advice about supervising sonography students. The contents of the video are: 1. Giving good example. 2. Engaging with and involving students. 3. Discussing matters and affirming students. And a brief word about course learning outcomes. Firstly, giving good example. Model the kind of practice you expect. That is, by your example, let students see how you should and how they should treat patients, acquire images, make measurements, and deal with colleagues, etc. Provide clear instructions. When dealing with students and with patients, aim to make matters easy to understand. Link theory and practice. This will help students understand concepts more clearly. For example, you may choose to explain one or two of the limitations of ultrasound when you encounter an imaging artifact. Or you may want to highlight why certain images in an exam are particularly important for addressing the question on the referral. Explain aloud what you're thinking. This will help students to recognize the different matters that you, and in time that they, will consider when imaging. Reassure your student by providing positive feedback about work well done, or in relation to a good effort when an outcome may not have been entirely to plan. Next, engagement and involvement. Solve problems together. For example, help them to determine whether the images they acquired and measurements they made are similar to patients' previous images and measurements. Again, explain aloud what you're thinking as you solve problems, as it will help them to recognize the different degrees of importance in a case. Help students to break down complex tasks. Remember that there are many aspects to practicing as a sonographer, and all of these can be overwhelming or seem overwhelming when starting. So break tasks into more manageable elements, like you would do for other complex skills that need to be learned. Work on a few of them at a time and gradually increase the level of complexity. Set aside time to meet regularly with your student. Together, set some goals, perhaps in keeping with the SMART principle, which recommends that goals be specific, measurable, attainable, relevant, and time-based. Together, review the goals you had set and decide based on progress whether to keep them or to set new goals. Discussing matters and affirming students. Try not to correct students in public. Of course, simple recommendations about how to improve an image or a measurement are needed, and this may occur while they are imaging. However, long and important corrections shouldn't be made in front of patients, but are best made soon afterwards when there's time and the appropriate degree of privacy. Identify and reinforce students' strengths. For example, if an image was particularly good, or they dealt well with a patient before or after an exam, congratulate them on that. Importantly, identify areas of weakness and ways for them to improve. For example, if they're struggling to acquire certain images, indicate why the image or images are deficient, and show them what the standard they should be aiming for is, and make some recommendations about how to improve. Finally, course learning outcomes. There are 7 learning outcomes for the Graduate Diploma in Cardiac Sonography. Clinical supervisors play an important role in helping students to achieve them, especially in the following 3. The development and application of in-depth knowledge of normal and abnormal cardiac anatomy and physiology in the practice of cardiac sonography. The utilization of advanced knowledge in the operation of ultrasound machines and ultrasound physics in the practice of cardiac sonography. And acquisition, interpretation, and measurement of high-quality echocardiogram images. To put it in more practical terms, examples of how supervisors help to reinforce what students are being taught are by helping them to recognize aspects of normal cardiac anatomy when they are imaging, such as the round shape of the left ventricle compared to the more elliptical shape of the right ventricle when viewed from the parasternal short axis view. By helping students recognize how to optimize images by adjusting machine settings like frequent adjustments to the overall gain and even more frequent adjustments to the time gain compensation, and by maintaining a high standard in terms of image quality and measurement technique. Thank you for supporting the sonography program at Western Sydney University.